Hello everyone. In today's CT Registry video, I have a lot of exam practice test questions for you all. Could you please give the video a thumbs up and hit the subscribe button if you want part 2? So I have my CT certification with ARRT, but you can use these questions to follow any national CT registry boards. Put it in the comment box if you are taking your ARRT registry or if you from another country and taking the national CT board registry. So with ARRT on their registry exam, they are going to have a total of 165 questions. You can see it right here at the bottom. And then just know that there will be an additional 30 questions, but these questions are unscored, meaning these are questions that you do not know will be scored or not, graded or not. So you still have to get majority of the answer choices correct because you do not know which one is graded, which one is not graded. Physics is the largest part of the test, so just make sure that you know your physics. You can comment and let me know if you need more physics questions or if you need more anatomy questions. I have a disclaimer for you all. Could you please read because this is very important. These practice test questions and answers are made to help you all pass your registry exam. Due to the Registry Board's copyright law, these questions will not appear on your registry examination in this exact wording, but they are designed and constructed to test your knowledge in order to help you pass your registry exam. Since it takes time, effort, and research for me to make these questions for you all, I am going to read each question, answer choices, and the correct answer to avoid anyone from reusing my material and voice. If the audio bothers you, please mute the video. Being so these questions are available to you for free, could you please like, subscribe, and share the video? I would really appreciate it. Thank you all for watching and good luck on your registry examination. Please give the video a thumbs up or leave a comment if you would like part 2 to these questions and answers. These videos will prepare you to pass your ARRT CT registry exam or any national CT registry boards. This can also help prepare you to pass your ARRT CQR CT assessment that will be every 10 years. And I do have a lot of CT registry review lessons in my playlist. If you just go to the description box under the video, you can see the link to click on it. All right, so here we go. Like I was saying, for your Q&A, I will read the question, the answer choices. I'll give you a moment, and then I'll tell you what the correct answer is. All right, so for question 1, the ability of a CT scanner to differentiate between two objects or structures that are close together in space is called contrast resolution, noise, spatial resolution, or temporal resolution. I'll give you a few more seconds. Okay, the correct answer is spatial resolution. Question 2, which of the following is considered a normal pulse rate for adults? Is it 30 beats per minute, 40 beats per minute, 50 beats per minute, or 60 beats per minute? Okay, the correct answer is 60 beats per minute. The pulse rate for adults range is between 60 to 100 beats per minute. Question 3, which of the following is considered a normal pulse rate for children? 40 beats per minute, 50 beats per minute, 60 beats per minute, or 70 beats per minute? Okay, the correct answer is 70 beats per minute. The pulse rate for children range is between 70 to 120 beats per minute. Question 4. The ability of the CT scanner to differentiate between tissues with similar densities or attenuation values is termed contrast resolution, noise, spatial resolution, or temporal resolution. Okay, the correct answer is contrast resolution. Contrast resolution is the ability of the CT scanner to differentiate between tissues with similar densities or attenuation values. You may have to go back to a couple of slides, maybe question 2 or question 1, to know the difference between spatial resolution and contrast resolution, because those two terms, people get those two terms confused. Question 5. Which anatomy structure is the green arrow pointing to? Okay, the correct answer is the spleen. The spleen is an organ that is the most common site for injuries and trauma to occur. Question 6. Which anatomy structure is the green arrow pointing to? The green arrow is pointing to the ascending aorta. All right, so if you are finding this video helpful, could you please like, share, and subscribe for more videos? Question 7. A mild adverse reaction to contrast media is facial edema, sneezing, tightening throat, or wheezing. Okay, just a few more seconds. Okay, the correct answer is sneezing. Sneezing is considered a mild reaction to iodinated contrast media. Facial edema or swelling, tightening throat, and wheezing is considered a moderate reaction to iodinated contrast media. So when we're giving patients contrast, we are supposed to, you're supposed to tell them so they can know how the contrast will make them feel and give them a warm sensation, make it feel like they're, you can say, urinating or peeing on themselves, and it's going to give them a metallic taste in their mouth. Question 8. A two-dimensional grid of numbers that are arranged into rows and columns are called pixel, proton, matrix, or voxel. Okay, just a few more seconds. Okay, the correct answer is matrix. Question 9. A filtered beam that is more homogeneous and is less susceptible to artifacts is called beam hardening, bow tie filters, filtration, or half value layer. The correct answer is beam hardening. Question 10. Which anatomy structure is the red arrow pointing to? Okay, the correct answer is the pulmonary trunk. Question 11. Which of the following controls the quality of the X-ray beam? Contrast resolution, milliampere seconds or mass, peak kilovoltage or kVp, or your spatial resolution? Okay, just a few more seconds. The correct answer is peak kilovoltage or kVp. This is the peak voltage applied to the X-ray tube, influencing energy and penetrating power of the X-rays produced. Question 12. Which of the following controls the quantity of X-ray photons produced? Contrast resolution, milliampere seconds or mass, peak kilovoltage or kVp, spatial resolution. All right, the correct answer is milliampere seconds, your mass. This is the product of the tube current, MA, and the exposure time, S, or seconds. It influences the number of X-ray photons that are produced. This impacts the image quality and radiation dose. Question 13. Which of the following controls the overall brightness on the CT image? Contrast resolution, milliampere seconds or mass, peak kilovoltage, your kVp, or spatial resolution. Okay, the correct answer is milliampere seconds, your mass. For question 14, which anatomy structure is the red arrow pointing to? Okay, the correct answer is the left pulmonary artery. All right, so if you do not mind, if you could please let me know in the comment section which area of the test that you think you would need the most help with. I'm trying to make more videos or questions and answers or more review lessons for these type of categories to help you. So is it patient care? Patient care is one of those things where people think it is the easiest, but I'm telling you, it could be the category where you can miss a lot of easy questions in that category. So you still have to know and study patient care. Is it physics or is it anatomy that you think you'll need more help with, that you're probably weak in right now or you're not as confident with? So just let me know in the comment box so I can know which other type of videos I should make. Question 15. Which anatomy structure is the red arrow pointing to? Right, the correct answer is the right pulmonary artery. Question 16. Which anatomy structure is the red arrow pointing to? All right, the correct answer is okay. The correct answer is the left pulmonary bronchus. Question 17. Which anatomy structure is the red arrow pointing to? The correct answer, okay, the correct answer is the right pulmonary bronchus. Question 18. Which of the following occurs when an incident X-ray photon interacts with an outer shell electron of a target atom? Is it coherent scattering, Compton scatter, pair production, or photoelectric absorption? Okay, the correct answer is Compton scatter. Question 19. Which anatomy structure is the red arrow pointing to? Okay, the correct answer is the descending aorta. Before I forget, because I was going to mention this at the end of the video, but I feel like I may forget, in my CT registry review playlist, I already have like 3 or 4 Q&A videos. I have one for physics that a lot of people enjoy and they keep coming back to, so I'm going to attach that one to the end of the video. Also, I have one for patient care that I'm going to try to remember to attach it at the end of the video. But if, just in case I forget, which I'm going to try to do, it's going to be at the end of the video on the screen for you. Just click on the next video. And I can also put it in the description box to the playlist. Question 20. Which procedure is used to screen for colorectal cancer? Is it CT colonoscopy, CT cystography, CT pulmonary embolism, or CT voiding cystourethrogram, also known as VCUG? All right, the correct answer is your CT colonoscopy. Could you all let me know in the comment box if you've seen like a CT virtual colonoscopy done? This is pretty much done with the patient starting off on their left side, so you can tip the patient and then they roll. When I say tip the patient, you're tipping them with the barium enema like tubing. Um, you you put gel on the tubing and then you have the patient roll on their left side so you can insert the tubing and then when in their backside, and then after that they roll on their stomach. You take pictures like that after you have injected like a lot of air. Depending on how much the patient can tolerate, you're going to pump up like the airbag and inject anywhere from 50 to 80 squeezes of air. Like you have to inject it to where the patient can tolerate it, and then when you do the scan, it's just going to give them different prompts. It's going to let you know when to switch them on their back, and then you'll scan them again. All right, so if you can, please leave a comment for me. Let me know if you plan on working in a hospital or an imaging clinic as a CT tech. Also, if you have any Q&A questions that I can answer, like how it is being a CT tech, the route you can take to get to it as far as educational, just let me know and I can make a separate video if you all have a lot of questions. Question 21. The normal blood urea nitrogen range for adults is it 1 to 5, 5 to 10, 7 to 20, or 10 to 30? And all of these will be in milligrams per deciliter. Okay, the correct answer is 7 to 20 milligrams per deciliter. Question 22. The KVP range in CT is it 50 to 100 kVp, 80 to 100 kVp, 100 to 110 kVp, or 100 to 140 kVp? All right, the correct answer is 100 to 140 kVp. Question 23. If the mass is double, the dose will do what? Will it decrease? Will it double? Will it increase by 1/4 or decrease by 1/4? Just a few more seconds. All right, the correct answer is the mass will double. Question 24. What happens when the mass is increased? Image noise is decreased, temporal resolution is increased, spatial resolution is increased, your pixel size is decreased. All right, the correct answer is your image noise will decrease. So a lot of times when you probably will have to bump up your mass, I know for a fact, especially whenever I'm doing the CTPE exams where you have to smart prep, and sometimes you can't see where to put your ROI, and sometimes that's because of a patient's body habitus. So when I use, and I think this is on Siemens scanner too, but when I use the GE scanner, sometimes if the machine see that you are trying to increase the mass a little bit too higher than what it wants you to, it will like give you like a message or a prompt, and you have to type in the reason why you're increasing the mass. I just keep it short and simple and say due to body habitus. But sometimes you will have to increase it, let's say from 50 to 60. I'm just throwing out an example to decrease the noise that you will see on the image when you can't see based off a large body habitus. Question 25. The purpose of a CT filter is to absorb low energy photons to reduce patient dose, absorb high energy photons to reduce patient dose, absorb low energy photons to increase patient dose, or absorb high energy photons to increase patient dose. All right, in a few more seconds, I will give you the answer. The correct answer is to absorb low energy photons to reduce patient dose. Question 26. Which radiation unit is the effective dose or equivalent dose that indicates the potential health risk from radiation exposure to tissue and organs? Is it your becquerel, milligray, millisievert, or Rankine? Okay, the correct answer is your millisievert. Question 28. Which anatomy structure is the red arrow pointing to? All right, the red arrow is pointing to the radius. Question 29. Which anatomy structure is the red arrow pointing to? Right. The correct answer is the ulna. Question 30. Which anatomy structure is the red arrow pointing to? The correct answer is the scaphoid bone. Question 31. Which of the following measures the total exposure the patient receives for the entire CT scan? Is it CT dose index, dose length product, multiple slice average dose, or volume CT dose index? Wait, just a few more seconds for the answer. The correct answer is dose length product. Question 32. What is the annual dose limit for radiation workers that live in the United States? 10 MSV, that's millisievert. 25 MSV, 50 MSV, or 70 MSV. So MSV stands for millisievert. Okay, the correct answer is 50 millisievert. And also, you may think of 5,000 millirem. So the answer is either 50 millisievert MSV, or if it's actually in millirem, it will be 5,000. Question 33. Which endocrine structure secretes the hormone called melatonin? Your cerebellum, your pineal gland, pituitary gland, or thalamus? All right, the correct answer is your pineal gland. Question 34. A 2D squared element that makes up the matrix is called, is it field of view, pixel, proton, or voxel? Right, the correct answer is your pixel. Question 35. A three-dimensional volume of tissue is called field of view, matrix, pixel, or voxel? Okay, the correct answer is voxel. Question 36. A two-dimensional array of numbers consisting of rows and columns is called field of view, matrix, pixel, or voxel? The correct answer is matrix. Question 37. The CT Hounsfield number for water is it 0, 10, 15, or 20? The correct answer is 0. Question 38. The CT Hounsfield number for air is 100, negative 100, 1,000, or negative 1,000. All right, the correct answer is negative 1,000. Question 39. The CT Hounsfield number for dense bone is 500, 1,000, 2,000, or 3,000. And if I should have said this at the beginning of the video, but if I'm going too fast with the questions, you can pause it or rewind it. The correct answer is 3,000. Question 40. The distal end of the spinal cord is called annulus fibrosus, cauda equina, conus medullaris, or nucleus pulposus. All right, the correct answer is conus medullaris. All right, so that's it for this video. Thank you all so much for watching. Please give it a thumbs up or leave a comment if you found it to be helpful to you. Also, leave a comment if you want part 2. And also, do you think the questions was enough? Would you like me to put more in the video? In this video, I had 40 questions and answers. So would you like me to have more questions and answers? Was it just enough? Did you like the mixture of patient care, physics, anatomy? Because like I was saying, you have to click on one of the videos to, and I did this because it's going to be up here on the screen. You have to click one of the videos that I already have for physics and patient care because these questions are totally different from those questions. So all of my questions are new questions that I make on my own. That's why I'm like, could you please thumbs up the video because I'm doing this like on my free time. I'm not getting paid to make these questions. But yeah, just let me know if you enjoyed it. I'm just trying to ask as many questions that you would like me to ask because I know sometimes people can have like a short attention span. So if the video is a certain length, sometimes people don't want to watch it. But the good thing about mine is most of the time I do timestamps. So if you click in the description box or if you click somewhere in the video, you can see like different breakpoints where you can see like which question you're on, or even if I do not have timestamps, you can just write down or take note of which question you ended at. So at least somewhere in the video, I'm letting you know what question you're on, instead of just having the questions. But anyway, just let me know in the comment box what you would like for me to do, and good luck on your registry. Thank you all for watching, and bye.